From County College of Morris, this is CCM All Access.
Hello, and welcome to CCM All Access, the program that brings you news and information from the County College of Morris. Students at CCM, members of the community, people doing good things. I'm Brenda Todd, and joining me today are three members of the Respiratory Therapy Program here at CCM. Welcome, everyone.
Yeah, thank you.
Would you like to go around and introduce yourselves? You can start.
I'm John Rutkowski. I'm the director of the program, and I've been the director of the program for some 8 years now.
I'm Kaylee Alada. I'm also a student here. It's my junior year here.
All right.
I'm Kyle Broster, and I am also a student here. This is my second year at CCM.
Okay, so respiratory therapy, is this kind of a new profession, Professor?
Yeah, compared to some of the other health professions, it's fairly new. It evolved and didn't really become a profession until probably the 1950s, where we had a professional organization, some standards set, and then we started looking at formalizing education. So that evolution brought us to where we are now.
Okay.
And
how long have we had it here at CCM?
it's kind of convoluted, but the program started here with CCM being the sole sponsor of the program, probably in about 9 years ago, about a year before I came. Prior to that, it was a consortium and went through some changes. So it's one of the oldest programs. We go back, one of the oldest programs in the country.
So before respiratory therapy became its own profession, that was handled really by a nurse or doctors?
Yeah, nurses, doctors, other technical people, mostly laborers that would move around large pieces of equipment, oxygen cylinders and such. And then as we developed the technology and the expertise and the physiological basis for it, it just evolved into the profession that it is today. Still evolving.
Mm-hmm. And can you tell me a little bit about the program itself? I know there's two phases, is that correct?
Yes, the program right now consists of two phases, a pre-professional phase, which consists of a standard core curriculum and then some specialized courses that lead the student to develop the skills that they need to enter the professional phase, which is the second phase of the program. So the professional phase incorporates more technology, lectures based on physiology, the types of therapy that we do, and also clinical experience, which is important for the students.
Now, as I understand it, Kaylee and Kyle, you are both in the professional phase.
Yes.
Correct. Okay. Mm-hmm. And what has your experience been?
It's actually really good. I'm a tactile learner, so doing stuff in regular classes is kind of hard. But once you get into clinical, it all makes sense, and meeting patients and how everything commingles or goes together. Commingles, they all just clicks right away once you're in clinicals.
Absolutely. So you do your pre-professional phase, and then you go to clinicals. Is that correct? You start working with patients after your first phase. Is that correct?
No. The professional phase consists of, the way I always describe it is we have a lecture, a lab based on the lecture, and then the students bring that and experience it in clinical. So it's as Kaylee was saying, it kind of, the clinical part brings everything together. So they spend 5 days a week on campus, and when we talk about full-time, we're talking about 40 hours a week plus study time. So they're here on lectures Monday and Tuesday. For the most part, we do our labs on Wednesday, and then Thursdays and Fridays, they spend 8 hours a day in the clinical situations.
So then you have to dedicate yourself to 40 hours? Is that correct?
If you don't, you're going to be way behind.
Yeah.
Yeah.
Yes. And do you have a choice of going part-time, or is that?
And then the professional part of the program, no, we always do it pretty much full-time.
Okay.
So straight through for 11 consecutive months.
Okay.
And the reason we do that is because when we tried to do it part-time, some of the students were complaining that they would forget some of the things that they needed to know. So we just decided at that point just do it full time. And I think it works better having everything concentrated and well structured. I think it actually makes it easier for the students. It's intense though.
Yes. Speaking of intense, as I understand it, you have 3 children at home, triplets, is
Yes.
that correct?
Yes, I have 2.5-year-old triplets, and I was actually a teacher for 11 years, and so this is my second act, you can say. And over their short life, they've all have had issues where they had to go to the hospital, and they have had breathing problems, and they've had RSV and some other breathing stuff going on. And as a new father, that's just such a scary time. It really was just simply terrifying. And I got to meet a lot of respiratory therapists, and that was my first real exposure to respiratory therapists and what they do, and just seeing them and how they helped my son and my daughter, and how they were not only helping them, but they helped me. They encouraged me, showed me support, and their compassion and dedication, that was just amazing. And it just, in such a scary time in my life, it was what I needed. And so not only were they helping my children, they're also helping me. And it really inspired me that this is what I want to do in my second act, and that I want to be able to do the same thing. I want to be able to encourage some people who's having a family member who's having trouble breathing, because it is such a scary thing. It's something that we take for granted, and it's just, once you are struggling with that, nothing else matters. That's the only thing that matters. And I just want to be able to help people in their time of need, in that scary time, because I've been through it, and it's, it really led me to this program. And, I'm just looking forward to helping people out any way I can, whether it's the patient itself or the family members.
Right. Breathing is, unless we have an obstruction or there's some reason we can't breathe, we take it so naturally.
We do,
right?
yes.
And if you have a regular problem with that, or you have a loved one with a regular problem, then you realize the importance of somebody who does what you want to do, right? So what is it like going into the clinic? You work in hospitals?
Yeah, so our whole entire group gets split up between 5 people go to this hospital, and the other kids go to other hospitals. So I'm at Overlook, and I have 2 instructors, one for Thursday and one for Friday. So whatever we have been doing in lab is what we do in clinical, and we practice our skills. So this past couple weeks we've been working on vitals, lung auscultation, which means you're listening to different lung sounds and differentiating between them, and how they can go with different diseases. So we've just been practicing that the past 2 weeks. Yeah.
Well, I look forward to hearing more about this. We're going to take a short break, and we'll be right back.
I'm Andrea Lucia, a graduate of County College of Morris. At CCM, I gained a high-quality education, was involved with clubs on campus, and performed university research in tissue engineering. My CCM education prepared me for ongoing success. Today, I am at Cornell University, studying engineering and performing research in cardiac tissue engineering. The professors and staff at CCM helped me to start right and finish strong.
And we're back on CCM All Access. I'm Brenda Todd, and we are here with the members of CCM's Respiratory Therapy Program. Professor, can you tell us a little bit about the prerequisites for this program? Because I know that there are some.
The prerequisites for the mostly the prerequisites for the professional phase. The rest of it is kind of almost like any other associate in applied science degree or associate applied science degree. They're pretty standard core. But to get into the professional phase, there's certain things that you have to have. You have to apply for the professional phase. You need to have a minimum of a 2.5 GPA. Then we consider all the applicants, and then once we determine who we're going to invite to the class, they have to do certain things for us that are required by our hospital. So there are things like background checks that have to be done. All of our vaccinations have to be done. They need a physical. They have to have a tuberculin skin test. And then, so there are a few other things that have to be done before they can start clinical. So that's so between probably the end of June and September, they've got to get all of those things done.
Okay. So you apply in March every year, right? That's the deadline, March 1st?
March 1st is the deadline.
Okay, and then from June to September, you're required to fulfill those
Right.
those requirements.
So all of the health information has to be completed.
Okay.
CPR, basic life support CPR for healthcare providers level has
Okay.
to be performed, and we need a certificate in that.
Excuse me, but do we offer that here at
Yeah,
CCM?
well,
or-
CCM does offer those classes
Okay.
here, but they can take those courses outside. Most hospitals offer them.
All right.
So there's lots of places, there's lots of opportunities for them to get the basic life support skills done and certified. Beyond that, once they get those things done, they'll be in the program and be ready to start clinical. Did I forget anything, Kaylee?
No, I don't
No.
believe so. I think
Okay.
that's all it.
So-
Gotta do a lot of stuff.
It's definitely a busy summer getting ready for
Oh, yeah, I can imagine, yes.
just a lot of doctor's visits and stuff. But it makes sense. You're working with people who are sick, and you need to not only protect yourself but also protect the patient. So it's definitely crucial to get vaccinated and do all that.
Absolutely.
And CPR is just a critical skill to have.
Yes, it's a serious program. How many students are in the program?
Well, right now we have 26 students in the program. We tend to lose a couple during the summer because they don't complete all the courses that they need. Our accrediting agency allows us to accept up to 30, and we can appeal to accept 33 on some occasions. So that's kind of our target, is to try to get 30 students into the program.
Right. Well, I would imagine that it sounds like a very, very serious program, these serious prerequisites, and maybe coming into the program, some of those students don't really realize that until they're really deep in it.
Yeah, I
correct?
mean, our attrition is pretty low. Sometimes we'll lose students because they find out once they get into the hospital, this is really not what they expected
Right.
the profession to be like, which is fine. So that happens. We have almost no academic attrition. The students that we pick are very dedicated to learning. They really want to do this. They've been working at it hard for quite some time.
Yeah.
And they tend to be quite successful. We've got a pretty good track record.
Very good. So, Kaylee, what are some things that that have been kind of unexpected for you that you've learned with this, good or bad?
Oh my god. So, I mean, this is very fast paced, and that usually wasn't my whole thing with my
Sure.
past years here, but I think it's good that how fast paced it is, because one, you learn so much. You actually do so
Yes,
much
and
stuff.
you're completely submersed in it.
Yes, and yeah, you just gotta go on get on the horse and just take a ride for it. That's all you
Right.
gotta do, and it's a good pace though. It's very fast, but it's good.
So you're impressed with yourself.
Yes,
keeping
I'm
up
very
with this
impressed.
fast- That's very good.
Very.
That's very good. And going into the clinic, what is that like? Is that what you expected it to be?
Yeah, a little bit. It's just kind of it's not scary, but just so different. Actually seeing your patients and how sick they can be,
Sure.
and certain precautions you need to take when seeing such patients if they have a certain, I guess you would say, level of sickness.
Right.
You have to put on gowns or gloves and
Yes.
all that stuff. But just actually seeing it instead of just
Right.
being in the hospital room with your father or a sick one at home, just seeing that is just so much different than that. Having someone that you don't know and seeing
Sure.
how sick they can be, and
Sure.
you're you want to be there for them and help them get better and make sure they get out of the hospital as quick as possible so they can see their loved
Absolutely.
ones.
And so, Kyle, that brings me to you, being on one side of it, and now you're on the other side of it. How is that different? What are the challenges?
There's definitely a challenge coming back to school the second time around, but there's also a lot of benefits to it. It's not my first time, and going to campus and going to classes, and so I'm able to have a better understanding, and I'm definitely more curious on when it comes to stuff at clinical. My instructors are always telling me I'm a little ahead. I'm asking questions a little more than I should be, but I'm just very curious and just want to learn as much as I can, make every opportunity, make the most of it, and just learn as much as I can. Just so I can be prepared for whatever patient I might be able to help and just be able to help them. But it's definitely once you get submersed in it, like, it's only been a month, but, just being so submersed in it, you pick up things faster than I think you would expect to. And the other great thing about the program is, like, we came in as strangers,
Sure.
but a month in, it's like I feel like I've known them longer, the other
imagine that
students,
is
and
true. Yeah.
you kind of
It's a small
become
group
a
and-
little bit like a family, good and bad,
Yeah.
both
Yeah.
ways. But you really get submersed in it, and it's just, it's really just a good experience. It is intense. It's not easy, but it's definitely worth it.
Well, thank you all very much for being
Thank you.
here
Thank
today.
you.
I really appreciate it. We're going to take a short break, and when we get back, we're going to take a tour of the Respiratory Therapy Labs. Stay tuned.
I'm Andrea Lucia, a graduate of County College of Morris. At CCM, I gained a high-quality education, was involved with clubs on campus, and performed university research in tissue engineering. My CCM education prepared me for ongoing success. Today, I am at Cornell University, studying engineering and performing research in cardiac tissue engineering. The professors and staff at CCM helped me to start right and finish strong.
Hello, and welcome back to CCM All Access. We're here at the Respiratory Therapy Lab in Cohen Hall, and we're going to go in and check out the classroom, see what the students are doing. Hello.
Hi, welcome to the Respiratory Therapy Lab.
Well, thank you for having us. Hello, everyone.
All right, the students have some equipment that they want to show you and some of the things that we do as we learn to work with patients in the lab. So we can start over here.
Okay, great. So we'll go around to each station, and the students can explain their equipment to us.
Hello, my name is Kyle Brotzer, and this is the Philips V60. This is a very important machine and other machines like it when it comes to respiratory therapists. This allows respiratory therapists to put a patient on CPAP and BiPAP. CPAP is continuous positive airway pressure, and BiPAP is bi-level positive airway pressure. CPAP, you would normally put a patient on CPAP mainly if they have OSA, which is obstructive sleep apnea. It's a very important device for someone who's having trouble at night when sleeping. The apnea means that they stop breathing, and we don't want that. So CPAP is able to give them the pressure they need to get a good night's sleep. Also, another feature is also BiPAP. BiPAP is bi-level, so there's two levels, one for inhalation and one for exhalation. It's a very crucial machine for people that have COPD, people that have a lot of CO2 built up. This machine allows them to get the CO2 out that's built up and blow it off, you could say. It's just a very crucial machine. It's important not only to know the machine, but know all the settings. This is the artificial lung simulating breathing for us right now. If I was to disconnect it, or actually alarm would sound, letting us know that something is wrong. It's very important to know the machines and the settings. When it comes to a respiratory therapist, it's almost like a triangle relationship between the respiratory therapist, the patient, and the machine. You need to know every aspect and how each part affects the other. And like our professor is always telling us, you can't just be so focused on the machines. There's a lot of machines we use, a lot of supplies. You can't be so focused on the machines and the settings that you forget about the patient. The patient always needs to come first. So you need to know not only what the machines can do, but how they're affecting the patient and how it's going to increase their chance of getting better. And that's really what we are. We're standing in the middle of life and death a lot of times, trying to make sure that life comes out on top.
Joada is going to tell us a little bit about listening to breath sounds. We call it auscultation, and there are specific patterns that we use in order to evaluate all areas of the lung, and we can figure out what kind of breath sounds we're hearing, what they mean, and then try to figure out what we should do about them. So, Joada, where would we start?
Okay, so we would start up here, making sure that you're not against any bone and you're not dragging. You're just going to compare bilaterally, and then you'll go down. You'll inhale, exhale, Inhale, exhale. Inhale, exhale. Inhale, exhale.
Okay, and then same pattern is done on the back also. You just keep going from
Yes.
side to side, always comparing one to the other, right?
Yes.
Now, what kind of breath sounds might you hear in the patient who has asthma?
Patients with asthma might sound like this. Patients with upper airway inflammation might sound like this. Patients with pneumonia might sound like this.
All right, so Jureda, when you're listening for the breath sounds, what types of things are you trying to evaluate?
The characteristics to listen for are going to be the pitch, the intensity, and the duration of the inspiration compared to your expiration.
This machine here is called the high-frequency chest wall oscillator. What it does, it provides vibrations and pressure on someone's lungs or chest area. So if, say, one patient had cystic fibrosis, they have excess mucus in their lungs. So what this machine does is it provides vibrations at a certain amount of hertz, which is cycles per second. So we're going to have you set up for 12. So what the hertz does, it'll help break up the mucus and thin it out. So it travels up into the upper airways, and it makes it easier for the patient to cough out.
So how long does someone usually stay hooked up?
It depends how bad their cystic fibrosis is. On this one that we have set up, it's only be 6 minutes, but it could be, if you have severe cystic fibrosis, it could be up to 45 minutes. Yeah, so I'm just going to take this little guy and just squeeze it. And it starts pumping, and it's like little vibrations. Some people think of it as like a chest massage, but
It's not scary at all.
not scary at all.
No.
Yeah, and then this guy is if you had like a bigger person, you can use this one. And the tubes that you see here, we hooked up right here and right over there. And you can also use them on little kids, so ages 3 and up.
Well, thank you very much.
Welcome. Thank you for demonstrating.
Hello everyone, my name is Satora Akbarova and I'm a respiratory therapy student at CCM. I would like to talk about the nebulizers that we use as a respiratory therapist. Nebulizer is a piece of medical equipment that a person with asthma or another respiratory condition can use as a administer medication directly and quickly into the lungs. A nebulizer turns liquid medicine into a very fine mist that a person can inhale through a face mask or a mouthpiece. First, we need to connect the hose to the air compressor. And then we need to put medicine like albuterol, Atrin into the cup. After we attach them, we need to turn them on into 9 flow. As you can hear and see, the mist is coming through. You place it on the patient, and you need to teach them how to breathe properly and take the medicine. Well, this procedure takes about 10 to 20 minutes depending on the dosage of the medicine. And before, after, and while doing this procedure, we need to take their pulse rate, respiratory rate, and their chest compression.
Hello, my name is Olga Shubina. I'm a respiratory therapy student, and I'm here to explain about mechanical ventilation. We have different types of mechanical ventilators that we use, and this is one of them. So what it does, it helps a patient to breathe when he or she, after surgery or trauma or critical illness, and cannot breathe on his or her own. So patient is connected to a ventilator with a hollow tube and uses it until he or she can breathe on her or his own. There are different types of mechanical ventilators modes that can be used for neonatals or for adults. And the person who is on ventilator may feel like breathing through a straw. So, and our goal is to help the patient to feel comfortable and get off the ventilator.
Hi, I'm Shannon, and I'm going to be demonstrating on pig lungs how high-frequency auscultation works inside of the lungs, much like Kaylee showed you on her high-frequency vest. The goal of the METNEV, which is right here, that does the auscultation, is to cause lung expansion. Lung expansion helps with atelectasis and opening up the alveoli. It is important to stress to patients to keep a tight seal on the mouth when doing the auscultation to ensure maximum alveolar penetration. This is what happens when you turn the METNEV on for auscultation. Usually you set the ideal flow to about 10 to 15 centimeters of water. And to ensure that this is working, clear breath sounds and minimum secretions are a good indication that the auscultation is working.
This has been another edition of CCM All Access. Thank you for joining us, and join us again next week. In the meantime, thank you so much for letting us come into your classroom and for showing us the equipment here. A big round of applause.